It's Melissa Sweet here from Blog, and I'd just like to introduce...
I'm Peter Sainsbury, Melissa, and I'm a firm advocate for action on climate change.
And you've just given a strong keynote presentation to the National Rural Health Conference in which you said health services are killing people. Why is that, and what do you want them to do about it?
Yes, well, I was making the point there that health services themselves are very big emitters of carbon emissions into the atmosphere, which I think is not well recognised in general or even by health services and health professionals. A paper was published last year that shows that Australian health services contribute about 7% of all Australian carbon emissions, and that's in line with research that's been published in Britain and the USA. So we are contributing, we're supposed to be saving people's health, preserving people's health, and yet we are contributing 7% of the carbon emissions that are then killing people through global warming. So that's the sense in which health services are contributing to global warming and killing people.
And what would you like them to do? How can they step up, I guess, in climate action?
Again, the research across those three countries, USA, Britain and Australia, is fairly consistent that people might think that the carbon emissions from health services are coming from the power that we use to run hospitals, heating, cooling and so on, and running medical equipment, and all the transport involved in health services. Again, the reality is, together they probably only explain about 30-35% of carbon emissions. The vast majority, around 3/4 of carbon emissions from health services, are what we do to patients, arising from things we buy from producers and that we then use in patient care. So for instance, the biggest contributor, single contributor, is medications we prescribe to patients. They are immensely carbon intensive in their production, packaging, distribution, and a lot of them are wasted. A lot of them get thrown away without being used, they're out of date or patients don't take them. And a lot of them don't do any good. We know that patients are being prescribed medications that frankly are useless.
So this is really adding weight to the arm of movements like Choosing Wisely.
Very much so. Choosing Wisely, movements like that, are very much the sort of hand in glove, hand in hand with the climate change movement on things like this. And there's some anaesthetic gases that are 100 times more carbon intensive than other anaesthetic gases. For instance, there's one anaesthetic gas, if you use it once in a sort of a regular operation, it's like driving to and from between Melbourne and Sydney. It's an incredible emission of carbon emissions. And it's the things we do to patients. We needlessly bring them into clinics. We needlessly order investigations. We can do it better, deliver better care, save money, and reduce carbon emissions.
And are we, it sounds like the choir's about to start.
It does.
Are we doing that, are we systematically trying to do that in Australian healthcare services?
That's the disappointment, Melissa. The health services have not yet really taken this on board. There's little pockets, there's champions of course, there's theatre nurses who are absolutely sort of vigorous on reducing waste and recycling materials and so on. There are people in engineering departments who are obsessive on putting in ED lights and saving power and so on. But these are people who are driven by a personal interest often. They're not getting a lot of support often from their hospital or health service managers. And what's really lacking is leadership from departments of health in states and territories and the federal government. They're not showing the way, providing the support, and we're not making it part of routine risk assessment and inclusion and quality and safety systems. Health services these days are really used to quality and safety systems and accreditation systems, and a group of us have been trying to get this sort of thing reducing carbon emissions, reducing environmental footprints into accreditation systems and into quality systems.
So say into the national standards on healthcare.
Exactly right.
And you haven't had any luck with that?
We have tried in the past without any luck. We're trying again at present, and we're getting a little bit warmer response, but at present, no progress.
Is this the Australian Commission on Safety and Quality that
It
you're
is,
talking about?
yeah.
Okay. So would you go on the record, what would be your call to the Australian Commission on Safety and Quality?
I'd say that they could seriously look at the issue of carbon emissions. In fact, the whole issue of the relationship between climate change and health services, it's not just about reducing carbon emissions and the rest of the environmental footprint. It's also about getting better prepared for the effects of climate change on health and health services, because they will be profound. That they should be starting looking at writing standards that will be included in accreditation processes around climate change mitigation and adaptation.
Okay, I think we may have some music starting here. Just so if we could just end quickly, I guess we've talked a lot about what healthcare can do about healthcare. What can health professionals and health services do about wider advocacy and change? Because really, even if healthcare addresses healthcare, it's not going to solve the problem.
Yeah, actually, I'm pleased you gave me that opportunity. The fact of the matter is, health professionals are highly respected in the community. When health professionals speak, politicians, the public, the media tend to listen. The second thing is that people care about their health, their kids' health, their parents' health, and so on. But people care about polar bears, but they're a long way away and they're polar bears. And people care about glaciers and even care about what's happening in Mozambique as a result of floods and so on. But it's a long way away. It's not in people's forefront of their minds. My health, my family's health is. So health professionals talking to patients, talking to colleagues and friends about the dangers of climate change, not just for polar bears and glaciers, but for their own health and their family's health and their grandchildren's health, that can be a tremendous motivator for those people, firstly to start looking at their own environmental footprint, but also become much firmer voices when speaking to politicians, when deciding how to vote for people who want action on climate change.
And on that note, could you please show us your T-shirt?
I can, I'm delighted. It says Stop Adani.
And why are you wearing that T-shirt to deliver this presentation?
Because although many people are aware that the Indian company Adani are proposing a massive mine in the Galilee Basin, which is in the centre of Queensland, this mine is completely unnecessary. We've got loads more coal than we need already around the world, and it will pump out, the coal burn will pump out immense amounts of carbon dioxide. It's essential that we stop developing new coal mines, and the Adani mine in Queensland is absolutely emblematic of something that mustn't happen. The Liberal National Party support it, the Labour Party are equivocating. With the election coming up, we need people to vote for parties that are committed to stopping the Adani mine and stopping all new mining.
Thank you so much. Now we'll just end by turning around for viewers who are wondering what's going on here. We're at the National Rural Health Conference where Dan